We're just going to wait a moment until we get the heads up that we're good to go. In that meantime, thank you all for being here. Appreciate the presence of the media. And we'll have an opening comment, and then I'll be following up with questions that you might have. So thank you again.
Good morning. Thank you for being here with us today for a press conference with NDP Leader Jagmeet Singh. Bon matin, merci d'être ici avec nous pour une conférence de presse avec le chef du NPD, Jagmeet Singh. We will take questions at the end, beginning with questions in the room before moving to questions on Zoom. So I will turn it over to you, Jagmeet.
Thanks so much, Lana. We're here talking about healthcare, and I just want to thank the healthcare workers that are behind me. These are some of the frontline healthcare workers that work in all areas of health, from home care, long-term care, nurses that work on the front lines in hospitals and critical care, acute care, and our healthcare system is in a rough way. We have to acknowledge that, and that's something that's very serious. We envision a healthcare system that's there for people, that you don't have to wait for hours and hours in an emergency room to get care, that your children don't have to wait for hours and hours at a children's hospital to get care, that family members that are promised home care get that home care, that family members that need to go to long-term care know that they can go somewhere that's going to be high quality and properly staffed with people that are giving them the care that they need. We know that that's something that we can achieve, and sadly, that is not what we have right now. And when we heard from these healthcare workers, we know the front lines are looking really rough right now, are looking really difficult. We know that people aren't getting the care they need. We know that the wait times are incredibly long. We know that people are struggling for hours and hours in pain to get access to the care that they need. We know that that's something that it's being experienced in home care, in long-term care, and in hospitals. And we know that right now, healthcare workers are being overworked, they're burnt out, and they're hurting as well. And we heard stories from healthcare workers sharing how they are not able to give the care that they're trained to give, and that they go home injured, hurt, morally and emotionally hurt, that they were not able to give the care that they wanted to give, that they were trained to give, through no fault of their own, just because they did not have the resources. And we know we're up against governments, conservative governments in provinces like Manitoba and Alberta and Ontario, who believe that the solution is to bring in more for-profit care. And we have a prime minister who is encouraging this. Prime Minister Trudeau said, this is fine, this is good, has encouraged that for-profit delivery. And we've got conservative leader who's, again, excited about the idea of more for-profit care because it's going to line the pockets of their wealthy friends. But what we know is, with more for-profit care, two things are going to happen. People are going to pay out of pocket. It's going to cost people more. As much as people claim that it'll be covered by the healthcare system, it won't be. We have ample evidence that when there's for-profit care, people end up with a bill. There's some way and somehow people will end up paying a bill. And the second thing we know is that it's not going to solve the problem. It's only going to make the problem worse. When we are faced with the healthcare worker shortage, which no one denies that we're short healthcare workers. And these healthcare workers are being overworked and they're being overburdened and they're under-resourced. No one denies that. But when we got healthcare workers that are being overworked, opening up more for-profit clinics, where are the workers going to come from? They're going to come from the already overworked staff, the already under-resourced hospitals, and that's only going to make the wait times even longer. So it's a no solution. And anyone who claims it's a solution doesn't understand the problem. It's not going to solve the problem. If the problem is a shortage of healthcare workers, opening up for-profit clinics isn't hiring more workers. It simply isn't. It's just shifting one from one place to another. It's actually poaching workers from a public system, and it's going to make things worse. And finally, we know with for-profit care, we get worse care. We've got ample evidence of that. When it's for-profit, some of the money ends up going towards profit. It goes to the pockets of rich investors. It goes to the CEOs. And that means all the public money doesn't go to the care for our loved ones. And so we are proudly and strongly fighting back and saying we've got to invest in public solutions, in universal healthcare, hiring more workers, respecting these workers, listening to these workers, retaining these workers, and recruiting more workers. And it's got to be a massive concerted plan to invest in our healthcare system so that people get the care they need when they need it. We know that's possible. It can be done, and we're fighting to make that happen. And these healthcare workers deserve it. They got to respect during the pandemic, and it doesn't end there. It has to be now in tangible, real ways that we respect these workers, because when we respect workers, we improve our healthcare. Healthcare is better when healthcare workers are supported. And that's what we believe in. We believe that every one of you, every person in our country deserves the best care possible. And that's what we're committed to fighting for. We know that you can't count on the Prime Minister or the leader of the Conservatives to defend our public healthcare system. That is what New Democrats are going to do. And that's what we're going to do, fighting alongside these healthcare workers to defend what we know Canadians cherish and believe in, but now needs our help desperately. We'll be there for you. Donc, je veux dire qu'aujourd'hui, on va parler des soins de santé. C'est clair que notre système de santé est en crise. Et le grand problème, c'est le manque des travailleurs, particulièrement le manque de travailleurs de santé. Donc, notre vision pour le système de santé, c'est on peut avoir les soins de santé quand on a besoin. Et on ne doit pas attendre des heures et des heures dans les centres d'urgence. Mais la réalité, c'est ici à Winnipeg, mais à travers le pays, on a des grands problèmes dans notre système de santé à cause du manque des travailleurs de santé. Et la solution proposée par plusieurs premiers ministres conservateurs, c'est d'ajouter plus des services de santé à but lucratif. On sait que le Premier ministre a appuyé cette position. Il a dit que c'est correct. Et on sait que le chef des conservateurs, c'est aussi quelqu'un qui a appuyé l'idée d'avoir plus de services à but lucratif. Nous, les néo-démocrates, sommes contre cette idée. On est contre cette idée pour deux raisons. Premièrement, ça ne va pas régler le problème. Parce que le problème, c'est un manque de travailleurs avec plus de services à but lucratif. Où est-ce qu'on va trouver ces travailleurs? On va voler les travailleurs des secteurs publics pour mettre plus de travailleurs dans le secteur privé et ça ne va pas régler le problème. Ça va élargir le temps d'attente dans les centres d'urgence dans notre système public. Donc, ça va empirer les choses, empirer le problème. Deuxièmement, on sait que c'est des pires soins. On a vu ça avec plusieurs preuves. Quand on a des soins de santé à but lucratif, les soins sont pires. On a vu ça dans les centres de soins de longue durée où les centres privés à but lucratif étaient où on a trouvé les pires conditions. Donc, ça va empirer les soins et ça va coûter plus cher. Donc, nous, les démocrates, vont défendre notre système de santé publique. On veut investir pour garder nos travailleurs, recruter plus de travailleurs, embaucher plus de travailleurs. Et c'est quelque chose qu'on peut faire. Et on va continuer de mettre la pression sur le gouvernement d'investir davantage dans notre système de santé pour sauver notre système et pour l'améliorer. Et c'est quelque chose qui est tout à fait possible. C'est quelque chose qu'on peut faire et on va continuer de se battre pour vous. Merci. Thank you. With that, I'm ready for any questions you might have, and we'll begin with questions in the room.
We're going to start over here with CTV Winnipeg.
Sure.
Hi. A lot of the issues you heard today are provincial health issues. So my question is about the national healthcare funding deal. Is it adequate? And if it's not, because the provinces, even when they're signing on, say it's not, is the funding adequate? And if it's not, how much is adequate?
The funding that's being proposed by the federal government is not directed towards the solution that we know we need. And that's my biggest concern. The problem that we're up against is a healthcare worker shortage. The Prime Minister made a big deal about having strings attached or conditions, which we supported. But when it comes down to it, we don't really see those conditions. And we certainly don't see those conditions or those strings attached being in any way linked to the actual solving of the problem. We believe, as healthcare workers are telling us, we need to invest in hiring more healthcare workers. And nothing in the agreement actually requires provinces to use our public money to hire more frontline healthcare workers. That's where we need to be putting money. That is one concrete solution that the experts agree, the frontline healthcare workers agree, and we know that is the problem that needs to be solved. We need more healthcare workers. So nothing in the agreement requires that. In addition, nothing in the agreement prohibits conservative premiers like here in Manitoba from using our public money, our hard-earned public money, to end up lining the pockets of rich CEOs and investors who own private clinics. That is a problem because with private clinics, it's going to cost you money. We've seen in province after province, auditor generals have pointed out that even when there are claims that the for-profit services will be covered by the province, that those for-profit clinics find a way to charge people and people end up paying out of pocket. It happens. That is a serious problem. No one should get access to care based on how much money they have. Everyone should have access to care because everyone should have the best quality care possible. And no one should be paying out of pocket for care, particularly when it's promised that it's not going to be out of pocket. So that's another major concern. And finally, we know that it's not only going to not solve the problem, it's only going to make the problem worse. If we have more workers pulled into or poached into the for-profit clinics, it's going to make the wait times even longer in our hospitals, in our children's hospitals, in emergency rooms, in the rest of our system. So it's going to make the problem even worse. So that's why I've got serious problems with the deal that the Prime Minister has negotiated with the provinces, because it's not going to fix the problems that these healthcare workers have pointed out to me and to many others.
So if you have a serious problem, that's your words, and there's a federal budget coming, I mean, and health's a big budget item, will your party support the next federal budget when it comes to a vote?
So that's not a decision.
See it, fair enough. You haven't seen
Yeah,
it,
yeah,
but-
yeah.
But health's a big budget.
Yeah. So we haven't seen the budget yet. So that's not a decision we're going to make today. We're going to wait and see the budget and we'll make our decision then. But we're going to make it really clear. This is a fundamental disagreement I have with the Prime Minister. Prime Minister believes that it's okay, that it's good, that he's applauded the decision of more for-profit investment in our healthcare system. We think that's wrong. We think that's fundamentally wrong. And that's a major disagreement. We have a major disagreement with conservatives, again, not surprisingly, who believe let's let the vulture circling our healthcare system in and make money off the backs of people who are suffering in pain. We disagree with that approach. We think our healthcare should be about the best quality care. It shouldn't cost you any money out of pocket, and it should go towards building a system where everyone gets the best care possible. That's what we believe in, and that's what we're going to continue to fight for.
We're going to go to the Winnipeg Free Press.
Sure.
Hi, on the bilateral healthcare funding, do you have any concerns about the accountability measures the province has talked about and the provincial government applying these funds appropriately?
Yes, I am deeply concerned about the accountability of our public funds going to provinces, particularly where those provinces have openly said they're going to use it for for-profit clinics. I don't want a cent of people's hard-earned public money going to line the pockets of a rich CEO who's making money off of people's pain. I don't want that to happen. I don't think any Canadian wants that to happen. I think every Canadian wants to see every dollar that we spend on healthcare go towards care, go towards our loved ones, go towards the best care possible, hiring these nurses and doctors and healthcare workers who provide the care that we need. That's where our money should be going. And so I'm deeply concerned that the money being allocated isn't, the accountability isn't there to ensure that it's going towards hiring frontline healthcare workers, that money is going towards actually solving the problem in our healthcare system, and fundamentally answering the question, what type of healthcare system do we want to build? Do we want to build a system that's there for people, that no matter how much you earn, it's there, it's not going to cost you money out of pocket, that's high quality? Or do you want to build a system where you've got lots of money, you get the best care, and if you don't have money, you don't get any care? You've got to pay out of pocket, where profit comes before people. That's not the type of healthcare system I want to build. And I'm very confident that's not the healthcare system that Canadians want to build. And this agreement doesn't lay out the accountability to make sure we're building the system, that the Canadian healthcare system that we're proud of.
Do you have a follow-up?
We do. Our health minister recently said she was quote heartened about a recruitment program that we have here where 100+ nurses from the Philippines are coming to Manitoba. I know some folks you spoke with today touched on that. I was just wondering if you know much about the program, and if so, what are your thoughts on that sort of method of bringing in more nurses?
Well, we absolutely need to recruit more workers. That one program isn't going to solve the problem that we're up against. What we need to do is have a massive program of retention. So we first of all need to retain the workers we do have. And those workers that we do have are not being retained because the work conditions aren't sufficient, aren't good. We've got workers that are going in and are trained to provide a certain level of care and are not able to provide that level of care because they're not being properly supported. So they're leaving home morally injured. And I've heard this phrase be used, morally injured, because they feel pain, literally pain, that they weren't able to give their patients, the people that they care for, the care that they deserve and that they were trained to deliver. That is something that we have to respond to. So we need to retain our workers. We need to respect workers. A lot of the problems are workers are not being listened to, but people on the front lines know what's going on. They need to be listened to. They need to be consulted. Their feedback needs to be seen in the policies and the strategy that we implement. So we need to respect, retain our workers, and then we need to massively recruit new workers. And that involves hiring more workers. That means bringing workers that have left the field back. That means recruiting more locally, having more spaces for nursing, for healthcare workers, healthcare aides, more spaces in Canada for doctors. We need to look at ways that we can actually acknowledge the training of healthcare workers who are already here, who have international training, but aren't able to work in their fields. We need to make sure that we're finding ways to recruit those that have the training here and quickly have them, their qualifications recognized and then them work. But we need to see a massive effort of recruitment, and that one program alone isn't sufficient to deal with the needs here in Manitoba, nor across the country.
Can we go to Glenn from the Sun?
Thank you. This probably touches on your last response, but I'm going to ask it anyway.
Sure.
You spent an hour with healthcare workers hearing their stories. Can you characterize what you heard, and is anything you heard this morning surprising to you, or I'm not going to say shocking, but surprising because you heard stories from the actual frontline workers?
I've been doing a series of roundtables with healthcare workers across the country. So I've been hearing a lot of stories, but I have to say, every time I hear these stories, it's still shocking each time I hear them. The fact that the people that we count on when we're down and out, when we're in pain, when we need help, those people that take care of us, these healthcare workers, are feeling so insecure, so unsafe, the levels of violence they're experiencing, and how overworked they are. Their mandatory overtime, not being able to get home to their loved ones in time. The fact that the people that care for us are not being cared for is deeply concerning. So the major thing that I heard is that workers love their field. These workers, the healthcare workers, love what they do. They love caring for people. They got into this because they wanted to care for people, but they're not able to care for people in the way that they're trained to do, and that hurts them. That's one major thing I've heard. And the other major thing I heard is that we can fix this. We can fix the healthcare crisis if we really get serious about hiring more healthcare workers and respecting those workers. And ultimately, people are better off when that happens. People who've been waiting for hours and hours in emergency rooms, people that are wondering in pain or wondering in worry while their children are in pain. These are our fellow Canadians, our neighbors, the people who live in our community who are worried because our healthcare system is not there for us. But we can fix that. And that was some of the hope that I had coming out of this meeting and many others, where there are solutions. We have to be committed to hiring more workers and protecting our public healthcare system so it's there for everyone, and we can do that.
Going back to Glenn for a follow-up.
Yeah, I know the representatives from the Health Sciences Center spoke about the violence in their workplace. Can you comment on that as well?
Yeah, it's really troubling. It's really worrying, and it's frankly just completely wrong that our healthcare workers who are caring for others have to worry about their own safety, and they don't feel safe in the workplace, nor do they feel safe being able to get back to their cars or get back home. And so we have to respond to that. That is a real plea that's come from healthcare workers across the country, hear from the workers that I've heard from. They have to be safe in the workplace, and we have to take their safety seriously. And so we have to find solutions to the problems that they're up against. That's something that really struck me, that the people that care for us themselves are not safe. That to me is really just wrong. It shouldn't happen. And we've got to take their safety seriously.
We're going to go to CTV National.
Hello, Jill McIshon.
Hi
Thanks
there.
for taking our questions. I'm just going to change topics. You're one of the first federal leaders to really use TikTok on the campaign trail and since. Are you worried you're losing an effective tool to appeal to young voters?
Well, I want to be able to reach out to people wherever they are, whether it's in a community center or on a social media platform. I really believe in using every tool I have to be able to get out to people and speak to them and hear from them and share my views. But I have no concern at all about taking a step back from a social media platform when there are serious concerns around security, around data and privacy, particularly not just for myself and for my own device, but the people that interact with me. So taking a pause to assess how we can do it safely is something that I feel very comfortable doing, and I have no hesitation to do.
There's these security questions around the app, and now we're hearing from the Globe and Mail that there are serious issues potentially being leaked about our previous election. Could this become a non-competence issue for you if the government doesn't call an inquiry?
Well, we've said really clearly that we take this kind of range of political interference issues, the foreign interference from a government, to what we saw with the spy balloons, now with TikTok. There's some serious concerns around our security. With the political interference, that is something that we take very seriously. And seeing what's going on in committee, that we've got liberal and conservative members playing a political game, trying to score points, who's worse or who's implicated. Both have implications. For New Democrats, the goal isn't to score points on this and see who's worse and who's actually caught up in it. It's to find ways to protect our democracy. So that's what we're calling for, an independent inquiry. It's something we believe it's the right thing to do. A public inquiry would help us have confidence in our electoral process and identify the problems so that we can actually solve them. So we can actually ensure that our democracy is remaining strong and vibrant. So that's my position. We've not made a decision in terms of where the government stands on this. We're going to continue to apply pressure. We believe it's the right thing to do, and we hope that that's something that we can make happen.
We're going to go to CBC National next.
Yes,
Hi, Karen Pauls. Thank you for our questions.
of course.
Just wanted to follow up on that a little
Yeah.
bit. What do you think a public inquiry could uncover that a parliamentary committee can't?
Well, the issue with the parliamentary committee, for anyone who's been following it, it's been caught up in partisanship where it's really about the conservatives trying to score points on the liberal government, the liberal government trying to score points on the conservatives, because from the security information that we have, both parties have some allegations or some instances where there was foreign interference in nomination meetings. And we don't want to get caught up in who it is, which nomination meeting, which party. We actually want to get focused on the solutions. We want someone independent to take this out of the partisanship of the committee. The committee work can continue and we support that, but it's become clear that it's more interested in scoring points rather than finding solutions. I actually want to protect our democracy. I want to protect the importance of our democratic processes. I want to make sure that they are strong and that they're free from a foreign government interfering. And to do that, a public inquiry has the independence, the autonomy to be lifted out of that partisanship that we're seeing in the committee to actually get the job done. And that's what I want to see happen. I want to protect our democracy. I want Canadians to have confidence in our electoral process. And I think that's something that can be done with a public independent inquiry.
Just to follow up on that, how important or how concerned are you that this whole process will sow doubt in the competency of Canadian institutions? And what role do MPs have to play in creating that doubt?
Well, I think what we have to do is be very transparent and measured in our response. So one, so far, it should be very clear that none of the experts have said that this in any way has changed the outcome of the election. So I think that's something that we've got to be consistent on for transparency, and that's the facts. That's the truth. So we got to be truthful, but we have to take it seriously, even though it didn't impact the entire election. The fact that it impacted potentially candidates or elected officials is something very serious. And then that's something we have to take seriously. And so taking the concerns seriously, I think, is the responsibility of elected officials, not using hyperbole or exaggeration, but being very honest and straightforward. This is a serious concern. It is, so far, the allegations are that there was interference in nomination meetings. That is a problem. That shouldn't be happening. And the interference is very specific in nature. A foreign government, like a government, should not have influence over who is being nominated as candidates. So far, that's what we've heard. That is a problem that needs to be addressed. We should take it seriously. I think we need to have public inquiry, and MPs have to be very measured and transparent in their commentary around this. I think that's very important as well.
We're going to go back to questions on Zoom. Pass it back to you, Alana.
Back to you, Alana.
We will take questions on Zoom. If you have a question, please use the raise hand function. Each person will have one question and one follow-up question. We're going to begin with a question from Maura Forrest. Go ahead, Maura.
Yes, thank you. Can you hear me?
Yes, I can.
Great. I just wanted to go back to TikTok for a moment. You're taking a pause now. Is it possible you're going to leave the platform entirely? And what does that decision ride on? When will you make that decision? And are you going to direct your caucus to stop using the platform as well?
So with the platform, we are going to follow the House of Commons rules, and all members of Parliament will follow those rules. So it'll be removed from our federal devices for anyone that's been using or has it on a federal device. That'll happen. We'll comply with that rule. In terms of the pause, we'll take a pause now and assess is there a way to use it safely, and we'll consult with folks that can give us advice on that. And if there is a way to use it safely or not, that will determine whether we continue to use the platform.
Okay, but just in terms of taking a pause, are you going to direct your caucus to take a pause as well, or is that just you? And then my follow-up question is, what would you say to Canadians who are trying to decide right now, who are watching this news and trying to decide whether or not they should keep using TikTok?
I'll start with your second question. I think that is a really important question for Canadians to make, given the seriousness of the allegations that there is potentially the way TikTok stores data, leaves the device open to cyber attacks is what's been identified as a potential threat. That's something pretty serious, and so I take that seriously, and I'll take that pause until I can assess if there's a way to use it safely. That's a decision I'm making, and for the rest of caucus, we'll be complying with the House of Commons rules, and that's something that all New Democrats will be doing.
Our next question comes from Christian Noël.
Bonjour, merci de prendre notre question.
Oui,
Écoutez,
bonjour.
ça ressemble un peu à la question de Madame Forrest. J'essaie de comprendre. Là, vous prenez une pause, mais allez-vous continuer de l'utiliser sur votre cellulaire personnel, TikTok?
Non, je vais prendre une pause d'utiliser TikTok. Donc, ça veut dire je vais suivre les règlements. Donc, ça veut dire qu'on doit l'enlever. J'ai déjà le fait, enlever de notre cellulaire gouvernemental. Donc, j'ai déjà fait ça. Et tous les députés de mon parti vont suivre les règlements de Chambre de communes. Donc, j'ai fait ça et toute mon équipe va faire ça aussi. Et à la pause, on va prendre une pause même sur mon cellulaire privé. Je vais prendre une pause pour vérifier s'il y a une façon d'utiliser la plateforme dans une manière sécuritaire.
Demain, le comité sur les procédures de la Chambre va entendre des témoins concernant l'ingérence chinoise dans les élections. Vous espérez apprendre quoi? Et à quel point est-ce que vous êtes inquiet des récentes révélations qui touchent notamment la Fondation Trudeau?
Qui touche la fondation de Trudeau.
De M. Trudeau.
Oui. Ah oui, ces allégations, je suis inquiété par les allégations qui touchent la Fondation Trudeau. C'est un autre exemple d'ingérence du gouvernement chinois dans les domaines canadiens. Donc, ça, c'est une inquiétude. Ce qu'on veut savoir des témoignages, c'est exactement quoi l'ingérence et comment on peut éviter ou comment on peut défendre notre système de démocratie. Pour nous, les démocrates, notre but, c'est de défendre notre démocratie. On ne veut pas jouer un jeu politique sur cet enjeu. Ce n'est pas une occasion de gagner des points. C'est une occasion de prendre au sérieux la menace et de trouver des solutions pour garder notre système de démocratie. Ça, c'est notre but. Pour les autres partis, il me semble qu'ils sont plus... ils priorisent la chance ou l'opportunité de gagner des points. Pour moi, c'est vraiment maintenant un temps de trouver des façons de garder notre système sécuritaire.
Our next question comes from Raisa Patel.
I wanted to ask about some of the latest reports involving the Patented Medicine Prices Review Board and criticisms that the government asked the board to pause consultations on drug pricing reform. You know, we've spoken to people who say that these reforms would have set a foundation for the upcoming pharmacare deal your party is working on with the Liberals. You know, without them, it'll be harder to bring down drug prices in a national program, or not all drugs would fall into a pharmacare deal. So, do you think that the government's actions here could water down a future pharmacare program?
Yeah, I really want to take a moment here on this question. The question around the committee that sets drug prices is deeply concerning. That the Liberal government seems to be caving into the pharmaceutical lobbyists, and they're caving into pharmaceutical lobbyists in a way that costs Canadians money directly. It means that they They've caved into the lobbying efforts of these large corporations in a way that's going to drive up the cost of medication for Canadians and has prevented a lowering of cost. This is just beyond deeply concerning. The fact that the Liberal government, like many previous Conservative and Liberal governments both, are caving to corporate demands in such a way that hurts Canadians is fundamentally how we as New Democrats are different from the Liberals and Conservatives. They tailor their decisions to help out these large corporations, and it hurts Canadians. And in this case, a simple change that the committee had been asking, which was just to change the list of countries that we use in setting our drug prices, would significantly lower drug prices in Canada. And to put that into context, it means Canadians would pay less money for medication that they have to buy to stay healthy. And the fact that Canadians have to buy medication in a modern healthcare system is already a problem, because every other healthcare system in the world that's universal has included drug coverage, knowing that it makes no sense that you can go into a doctor and get a prescription and get care that's free, but you can't afford the medication you need to stay healthy. That makes absolutely no sense. And now the Liberal government, what it seems like, is allowing for pharmaceutical companies to continue to maintain elevated, higher drug prices, which was hurting Canadians, is so wrong. So we're going to continue to push back and say that the government shouldn't be listening to pharmaceutical companies. They should be listening to Canadians who are saying, we want more affordable medication. And we absolutely are worried that this is going to impact how we move forward on a national pharmacare plan. This year, a part of our agreement is to have a National Pharmacare Act, a Canada Pharmacare Act, which will be the legislative framework to move forward with pharmacare. A big step, something that the Liberal government with the Conservatives voted against 2 years ago. We're going to now have that happen this year, which we're happy with. But that's why we need a new Democrat government, because you need a government that's not going to cave into pharmaceutical companies, that's going to defend you and your family and build a pharmacare program that's national and that's affordable, that saves us money. And that's something that we're going to do, and we're committed to doing it.
And so where does this leave your deal? I mean, do you think that the government's actions here are going to water down what you want to see in pharmacare from this deal? And are you willing to accept that?
So the first step in terms of our deal this year is a Canada Pharmacare Act. That doesn't rely on the drug price setting right now for this year. So there's still time to encourage the government to stop caving into the pharmaceutical company, to encourage Prime Minister Trudeau to stop choosing big pharma over Canadians. So we've got time to continue to apply that pressure. This year, our agreement is to have the legislative framework, which is laying out how we will have pharmacare work for a national program. That's something that can move ahead, and we'll continue to fight back and say, big pharma shouldn't be deciding how we set drug prices. Canadians should have a government that puts their interests first, and that's what we believe in.
Our next question comes from Cindy Tran.
Hi, Mr. Singh. Just moving back to the topic of TikTok. So other leaders like Pierre Poilievre have suspended their accounts, have told members of their caucus to do so as well. And you're saying you're taking a step back, but does that mean you have plans to suspend your account? Because I just saw that it's currently still active.
Yeah, we're going to be deactivating the account. So it's going to be suspended. That's our plan by the end of the day today.
Okay, excellent. And my next question is that you've used TikTok in the past election, but in a report that said there were suggestions that some people have said that it makes you seem less serious when it comes to politics. What is your response to this?
Well, I want to be able to use any form I can to get the message out to Canadians that we're there for you, we want to fight for you, and I want to make sure I'm doing that in an effective way. I always look for feedback on how I can do a better job of delivering that message in a way that's persuasive, compelling, and convinces Canadians that New Democrats can be there for you for things like healthcare, for the healthcare workers behind me. I want them to know that we are the ones that are going to be there for you, to fight for you. I want Canadians to know that you can trust us to defend our public healthcare system, to make sure you or your family don't have to wait in pain for hours and hours at an emergency room or wait for months and months before you receive important surgeries. I want folks to know that I can deliver better healthcare, that my team and I can deliver better healthcare for you. And so I want to make sure I'm always doing the best job possible of delivering that message. And I'll always take helpful feedback into improving the way I do that.
We have another question from Cormac McSweeney.
There we go. Had to unmute that. You'd think after all this time I'd know how to do that. Anyway, just just wondering about two
You're
different
normally
issues
great at it, Cormac.
that's already been discussed, but I'd like to jump back to a question. I don't believe you answered it directly, just about the call for a public inquiry into election interference. Is this an issue that could put your supply and confidence deal with the Liberals at risk if they don't take steps to deal with the serious issue of foreign interference in our elections?
Well, that's not a decision we're making today in terms of if we're going to an election or not, but it is something that we take very seriously. I have made the call for a public inquiry. So far, the Prime Minister has said that's not something he's going to do. We disagree on that. I think it should be a public independent inquiry that investigates this, that assesses the real dangers and provides us with real transparency around what happened and ways that we can prevent it from having an influence in any way on our democratic system. I think that is important to have that independence, assess that risk, and to provide us with recommendations. So I maintain my position, and I will continue to apply pressure on the government to move forward on an inquiry.
And then back to TikTok, there are calls not just for government devices, but for an expansion beyond this. We know the US is looking at potentially banning TikTok operations out of their country as well. This is sort of a two-parter. You say you're pausing and suspending your use of TikTok and you're going to look into it a little bit more. Who exactly are you going to be consulting about using TikTok? And if you get the response back that it is a serious breach or could be a serious security issue, would you be calling the federal government to expand this ban beyond just government devices?
I think it's a really important question. So I'll take it in a couple of ways. First off, it's kind of a novel thing, right? Having to assess the way we use a social media platform. So I'll look to experts in cybersecurity, experts in digital security, and I'll look to the government in terms of the security services we have, CSIS and others that can provide us with good advice around what we should do and how we can operate in a safe manner. And so I think that's a prudent way to look at the risk and assess the risk. It's something that we're learning, and we're going to learn how we can best assess that risk. So I want to be open to the advice I receive. There might be other folks that I could look into, or other folks that I could hear from, but I want to take the risk seriously. I think it's what's been raised so far is something that should give us pause. That's why I'm going to be suspending my usage of the account and suspend the account itself, and of course following the House of Commons rules. And then in terms of what we do as a nation, I think that's, again, a very difficult question. We have to be very careful and prudent. There's a couple of competing interests here. We, of course, want Canadians to have access to information. We want to have freedom of expression. People use different platforms to express themselves, and that's important. And we also want to make sure that we're putting in place rules that protect Canadian security, their cybersecurity, their internet privacy, their data security. And so that's something we're going to have to look at. And we'll look at other countries in terms of the decisions they're making to give us some guidance. Again, we'll look to the experts in the field to give us the best advice. If it turns out that it's a serious threat to Canadians and a serious threat to our country, then we've got to take the appropriate steps. And so right now, what we're doing is exercising prudence, taking that pause, and listening to the advice of the experts as it comes forward.
I'm not seeing any more questions on Zoom, but I believe we do have another question in the room.
Yeah, one more question in the room.
CDTV in the room.
Sure.
Here's a tough one for you. The province released its homelessness strategy today. So we're just looking for a comment about what the national NDP strategy might be on and the importance of ending homelessness.
Okay. Well, I haven't seen the policy that's released by the province that was released today, but I can tell you for me as a leader of a new Democratic Party, we believe that in a country as wealthy as ours, there should not be homelessness. It should not exist in our country. The fact that it does is a failure, and we've got to respond to it. We need to really take the issue of housing seriously. In our country, we're seeing more and more, it is out of reach, not just for people with no income, people struggling with homelessness, but people with a good job are struggling to find a home they can afford. People look at the housing market and say, there's no way I can ever buy a house. It's just not possible. And it's only getting worse. On top of that, rents are going up. And so as a nation, we have to take the issue of housing very seriously. There has to be a serious strategy around how we build more housing that's affordable. How do we build housing that's not subject to the market? because we know the market is continually rising when it comes to the prices. We need to look at cooperatives and not-for-profit housing, look at non-market solutions to housing, publicly owned housing. We also need to look at how we tackle the housing market in a way where it's not that a first-time family is competing against a corporation with billions and billions of dollars who looks to make profit off the housing market in Canada and prices out a family that's trying to buy their first home. And then we've got to take really seriously the issue of homelessness. It's impacting every community across the country. It is an issue where people are not able to find a place to call home. People are on the streets, and we're in a cold country that has devastating consequences. So we need to take all this seriously, and we need a real strategy that builds more housing, that makes it more affordable, that responds to needs of all walks of life, from people who have no housing to people who have a good salary but still can't find housing. And that's something that New Democrats believe is a solution that we can find and something that we can fix, but it's going to take a lot of work, and we're committed to it.
This concludes our press conference today.
Thank you so much. Appreciate it. Thank you all. And I know there's a long press conference. I appreciate you all.
Didn't know you were listening to TikTok drama.
I should have told you.